Hello, my name is Colby. I'm a physical therapist here at Iowa Specialty Hospital. I just wanted to talk to you guys today about hip strength, kind of the role it plays in your everyday activities, and then also how some of the impairments, if maybe hips are weak or lacking control, how that can contribute to not only the sport activities you play, but your everyday activities that you have in life. So first of all, to understand the hip, you have to understand the movements that it does. So the main primary movement of the hip is what's called hip extension. So your ability to stand up, or if you're thinking like a hinge, so that is the role of the hips, help extend those hips, help you stand up. Another aspect is what's called external rotation. So if you're thinking of external rotation, those muscles in the hips on the outside are contracting when you're doing this movement, okay? So just like that. Another function of the hip is when you're standing here, if you're thinking about going out to the side, back in. That movement is called hip abduction. Those hip muscles on the outside are primary movers in that action. Another part that the hip controls is when you're going through your phases of your gait. So when you're leading, and say I'm leading with my left side, okay, your hip muscles are active in keeping your pelvis level. So now why is that important and why am I talking about it? So a lot of times if these muscles are weak, some of that can be referring to the low back. Typically low back pain can be associated with weak hips or something of that nature. Also, if you have weak hips or instability, that can translate to, say, you're loading your joints, whether that be a squat or say when you're jumping in your sport activities, doing things of that nature, and that may present something like this. So if you're squatting and you're noticing that your knees are caving in, something similar to that, or say you're in basketball or volleyball and you're jumping and your landing mechanics, you're noticing some issues there, okay? So those things, although it could be a plethora of different things, they can be indicative of, weakness in your hips. So that's why I wanted to talk about some of these things, because it translates well to a lot of young athletes. And I wanted to kind of show you guys some exercises just to get jump started to maybe address some of these impairments that you may be seeing, and we'll get started. So the first one that I'm going to do is, if you have a foam roll, you can use really whatever you want at home, anything that's going to provide you some resistance and some sort of tactile cue on the outside. So you're putting the foam roll up against here. This movement is just called an RDL, okay? So if you think about it, you're having to activate the muscles on the outside of your hip. You're applying pressure through here, maintaining contact with the wall, and you're simply reaching out like so. There, back down. Okay, so there's exercise number one. The second exercise I'd like to show you is with a Swiss ball. That would be the best way to duplicate this. They're pretty cheap. You can find them at any major box store. So your goal for this exercise, similar kind of setup. You're going to be applying pressure on the outside of your knee, and you're going up, so like up here, back down, up, back down. So it forces you to work hips on both sides, and maintaining contact there will help improve some of that stability and some of the strength in the area. So those are two quality exercises. I'll show you one extra exercise. So for this, although this is a pretty common exercise, I'll show you a little bit of a progression of it. So if you're thinking laying on your side, doing a simple plank, so just like so, holding here, bringing leg out to the side, back in. Okay, that exercise there helps, improve some of that core strength, but also allows you to address some of the hip strength. So if you have any interest in any of these exercises, or maybe noticing some of these instabilities or impairments, feel free to reach out to us at 515-532-9265, or if you'd like to set up a workshop so we can come talk to you, maybe show you more additional exercises or go more in depth with these, don't hesitate to reach out. Thank you for your time.